quality outcome framework registers that we have. But it's weird, because there are people out there who, sincere people, good people, some of them, who don't like the idea that we're focusing on dementia, who don't like the idea that we're diagnosing people with dementia. And there's some perfectly good reasons for this. This is a paper from the BMJ's Bad Medicine, or Too Much Medicine campaign series. And actually, if you analyse what's going on here, a lot of it is about fighting other battles over the bodies of patients with dementia. So it's things that are about national diktats and quads and quips and all the rest of those incentives that are out there. Yes, it's about concerns about the evidence base, but they're tiny concerns. And we have to make decisions on the basis of uncertainty. That's what we do as doctors, as nurses, as allied health professionals. And the language is remarkable. This paper includes the paragraph at the end, which talks about the curse of diagnosis. And which other disease would people feel able to use this sort of language about? And whose illness is it anyway? It's the people with dementias. Yeah. Is knowledge power for people with dementia? It is. Is ignorance bliss? No, it's not. It's not bliss for health services either. Because if you don't know, you can't manage the patient properly, and that's what causes all the problems in acute care, for example. And there are examples of good consensus that are going on to try and break this, break these kind of cycles of disbelief and these cycles of inaction. But actually what we need is good quality evidence on some of these things. But even without that, what we see is that since the introduction of our national dementia strategy, what we have is an increase in the number of people who are being diagnosed. So this is happening anyway. This is happening in our system, and we need to be able to deal with it. And there are simple things that we can do. Here's an example of some work that we did here from Brighton and Sussex Medical School. Myself and Reed Flaherty, who's from the Division of Medical Education, here ran a course for London that was about giving GPs a deep understanding of the issues of dementia and also the leadership skills to be the next generation of leaders for dementia in primary care. And as part of this, we created a way of recoding and cleaning up the primary care records and making them work better for dementia. And we ended up with an 8.8% increase after just 4 hours work in the number of people that were on these registers. Now that's important for the people with dementia because then they can be accurately identified and be given the right treatment. But this would be the equivalent to increasing your rank for your PCT by 70 places out of the 176 in the UK. This is a big change for just 4 hours work. Little things that